Hey, we're at Elite Healthcare, and I'm going to talk about probably my favorite exercise that there is, the pull-up. It is the other half of the posterior chain movements. Our posterior chain is designed to help us get stuff off the ground, squatting and deadlifting, and then to pull ourselves up or to pull something to us. And so the pull-up is the second half of that, and I've already talked a little bit about the deadlift. The reason that the pull-up is my favorite exercise is that I think it is the most productive exercise that almost any American can do. And of course they have to work up to being able to do it, but there are a lot of variations that you can do to work your way up to that high pulley rows, and I can talk about that stuff at a later time. But as far as the pull-up, the reason that it's so valuable is because it really offsets all of the wrong things we do with our posture throughout the week. If we're sitting at a desk job or surfing TV or clicking around on Facebook, whether we know it or not, we're assuming some form of this posture. And that posture has a lot of consequences. One of the consequences of that posture is that our scapulae, or our shoulder blades, these guys back here, come out and up. Now, I want to explain that just a little bit. Our shoulder blades tend to move with happy biomechanics, either out and up or down and in, wax on, wax off. And out and up is reflected in this posture. That out and up allows the expansion of our truncal muscles, our rhomboids, and the other postural muscles that hold us upright to relax and expand so that we can contract our chest and our abdominals and work on something that is in front of us with detail, which is a great thing, so we want that. So they come down and up to allow for that to happen. Now, the problem with that is that when you spend most of your time that way, instead of actually resisting gravity like a human, your body gets used to that, right? Just like it gets used to any sort of thing you do. Just think of simple flexibility or simple habits. You just get in a habit of drinking water, or you get in a habit of drinking Diet Coke. And our shoulder blades will get in the habit of being in this position. Now, over time, that causes a whole bunch of problems. Most immediately is it causes hypotonicity, or lack of tone, and lack of strength in all of the musculature in our mid-back, right in there. It's kind of hard for me to touch. All of the musculature in our mid-back responsible for pulling the scapula down and in. You see this worst case scenario a lot with women and girls, and it's clinically termed winged scapula, where when they put resistance on an object, or even just standing, their scapula on the inside actually wings out because it has so little muscle tone that it gets pulled off of the body. And this complicates all sorts of situations and causes all sorts of problems. And that winged scapula, a long time ago clinically, had to do with actual nerve compression. But now we see it all the time just in deconditioned women. And quite often these women are very active, they're just doing all of the wrong activities. So aside from the appearance of that stuff not being good, more importantly what happens is with the scapula chronically up and out, even when we're trying to be in good postures because we lack good muscle tone, we start to lose the sweet spot of our glenohumeral joint, i.e. where our shoulder is supposed to go. And then we start having all of these complaints about shoulder pain, bicipital tendon pain, and things chronically related with a down and in or an anterior-inferior resting posture of our upper extremities, of our arms. And when someone has a scapular issue where their scapula just at resting state lies in the wrong place, out and up, it makes it impossible for the arm to be where it's supposed to be. So we see that all the time clinically with people dealing with upper extremity problems, thinking that they have a nerve issue, or thinking that that they've had this big accident, when really it's a reflection of chronic poor posture and poor activity. And the other thing that we see it all the time in is neck and upper back pain. I would say that at Elite Healthcare, probably 50% of our complaints are neck and upper back pain. And along with anterior head carriage, what we see is this rounding in. Quite often people will think that they need to overcompensate, or that they need to compensate for that, I should say, when they realize that they're doing some of this. And then they do this, okay? And now this causes the exact same fatigue in the trapezius and into the neck, which causes these cervicogenic headaches that are a reflection of chronically tight and imbalanced muscles in that area, just the same as doing this. So what we really want to do is allow our body to have a strong, assertive posture where our shoulder can actually be completely relaxed and fall into that sweet spot of the glenohumeral joint. So what's so wonderful about the pull-up is that the pull-up very powerfully contracts all of the postural muscles versus an isolation exercise where we're just going to look at one muscle that seems to have dysfunction. The truth of that is that unless we have had direct, trauma like a muscle tear or direct surgery on a certain muscle, there's no practicality to completely isolating one muscle. So when we're trying to functionally improve the way that our motor system works, like our posterior chain, or the way that our scapula moves down and in, up and out, and to have a more appropriate resting state, we want to do really functional movements that apply to posture that we would want to have in normal life. And so what the pull-up does is that really, really accentuates and exaggerates the muscular contractions that we need to accomplish that. So what that means is that it's going to powerfully pull our scapula, our shoulder blades, down and in, and our chest up and out. Now, that only happens if we do pull-ups correctly. Pardon me. And that's the big point of this video, because I very rarely see anyone doing a pull-up correctly, and quite often people that think they're very good at doing pull-ups aren't even doing real ones, and then you try to get them to really activate the correct musculature, and they can't do it, okay? So what we want to do is have a conversation about a pull-up that is going to be rehabilitative and also very good for building functional strength and muscle as a byproduct of that. This isn't a conversation about kipping pull-ups or doing chins or any of those things, but I would recommend, for a lot of reasons, that unless you're in a pull-up contest or you're a professional pull-upper where you're getting paid prize money to do pull-ups in X format, and outside of if you're a CrossFitter, outside of your workout of the day is your WODs, that you specifically focus on doing the pull-ups that I'm going to talk about and doing them correctly, because they're going to give you a lot more benefit than a bunch of cheating pull-ups where you might think that you're getting more reps, but really you're not doing a whole lot of activation, okay? So with the pull-up movement, like I said, what we want to do is we want to accomplish getting our shoulder blades down and in, all right? This muscle right here, my lat, that's its job, is to pull things down and in. And we want to activate that lat in a way such that the latissimus dorsi, in a way such that we get full contraction of it. And then as we get full contraction of it, when we do that properly, it allows us to get our rhomboids in the lower half. See, our trapezius is a diamond, the lower half of that diamond, that bottom triangle, activated. Not only that, but you're also going to activate some of your lower back musculature, but more importantly, you're going to offload your traps, you're going to pull your shoulders into a better spot, and you're going to really powerfully activate your mid-back along with these lats. If you're only activating your lats, then you're not actually getting your scapula to approximate towards each other. There's two of them, obviously. So I don't want to talk a lot about it, but I just want to briefly say, generally speaking, what people are doing wrong. Generally, when I ask someone to do a pull-up, what they do is they hop on and they start pulling, and about right here, they start to crunch in, okay? So their pull-up ends up looking like this. And they might get really high if they're trying to show off and show me how strong they are, and pull up really high, but what they're really doing is they're just doing a crunch, okay? And they're actually starting to activate their chest, and they're activating their abdominals, and they're causing themselves to very powerfully contract in exactly the position that has caused them problems in the first place, and is exactly the position that you don't want to get into. More importantly, your abdominals and your chest, much weaker than all of the musculature here in the back. So they're robbing themselves of that development and actually the ability to do more work, to use more weight, or to do more repetitions, okay? The consequence of that, when this happens, is that they're merely pulling, like I said, with their chest. They're getting some scapula, some teres, a little bit of rotator cuff activation, but they're not actually approximating their scapula. It's not happening. And that's the whole point of the pull-up, okay? So the correct way to do a pull-up, as far as for a very functional, rehabilitative movement that not only does all the things that I mentioned, but also tractions your body out really well. And when we think about degeneration and arthritis, we're losing our ability to resist gravity. We're losing disc space in our spine. Our joints are losing space. And so this is a nice way to kind of offset that. When we do a pull-up, what we want to do is we want to complete the contraction with our chest out, head up, shoulder blades back, okay? When you come down, welcome to come to a full stretch here. But then when you come up, you only need to get to your chin, okay? But now look how my shoulders have contracted backwards, okay? My chest is up, and my shoulder blades are squeezed together, all right? Now, that would be a full, real pull-up. Okay? This actually isn't my favorite way to do pull-ups from a biomechanical standpoint. My favorite way to do a pull-up is with an underhand grip or a neutral grip. And I tend to use those forms, those versions when I'm doing them. But this straight bar is what most people are going to have access to. So I think it's the most important thing to talk about. So when I do this pull-up, I'm getting some stretch in my lats. I might even come in just a little bit to pre-stretch everything, including rhomboids and all of that stuff. And then my motion is to open my chest and to pull my shoulders down. I'm not doing this. I'm completely offloading my upper trapezius, my levator scap, all of that sort of stuff. Completely offloading it, and I'm pulling everything back. My arms aren't doing a whole lot of work. My arms are just levers for my back to work, okay? Going along with that, if someone is experiencing any sort of shoulder impingement or shoulder issues, and I'm a big fan of time under tension when it comes to training any sort of muscle and gaining some functional strength. I'm not talking about explosion, I'm talking about strength that can be maintained for a period of time. Think about like grappling or something like that, wrestling, if you're in high school or a student. What you want to do is you want to use partial repetitions, okay? And so partial repetitions does not mean that I'm actually doing any less work. In fact, I'm doing more work. But what I'm doing is I'm going to limit my range of motion to the region or the area that I want to encourage or accentuate in my body, okay? So if I am someone who has bad posture, or I have some winging in my scapula, or I just have some version of this going on, I want to encourage this. And if I come into big stretches every single repetition, one thing I'm doing is I'm offloading the muscle and I'm giving myself a chance to rest. But the other thing I'm doing is I'm reinforcing the fact that my scapulas don't need to be back here. If my scapulas aren't back here, I can't have this good resting posture, okay? I'm going to have this, and it's going to be painful to stand properly. So, my favorite way to do a pull-up, and as an example, this is with the straight bar, is to do this partial repetition movement where I'm just completely loading my musculature in the way that I want my musculature to behave, okay? So, What that means is I'm going to go ahead and I'm never going to let my elbows straighten out. I'm going to keep my elbows bent, all right? And the reason I'm doing that is by activating my biceps there the whole time, I'm also consequently activating my rear delt. And by activating my rear delt and my teres, I'm pulling my shoulder into the glenohumeral joint, okay? Once it comes out, I'm starting to have some impingement. If I can keep it right there, then my shoulder's in the sweet spot in that working zone the whole time. So when I do this repetition, I'm going to load my lats and my rhomboids constantly, keeping my chest out the entire time. And work to gain functional strength right in that area. I'm not worrying about stretching. Now, if we're bodybuilding or something like that, there's certainly a place for getting some stretch in the muscle. It's another conversation. But that's probably the most productive way to do a pull-up. I don't do a whole lot of pull-ups any other way. Like I said, I use a different grip, but my back development is pretty good. And if you try that, especially if you're someone that already has the strength to do a pull-up, you might be surprised at how difficult it is, especially if you're doing it under control. And that's another big point. No matter what you're doing, if we're talking about true strength and we're talking about rehabilitation, so my baseline for strength is my ability to move throughout life without stress, okay? So I don't really care how good you are at an exercise if you can't move throughout life well. Exercise in general, in my opinion, and most would agree, should be about health first and then go somewhere with that, but make that the baseline. So if you're doing a bunch of reps and you're doing this sort of thing, that's good for CrossFit, but that's not real strength. That's not good for life, okay? So what you want to be able to do, because you want to be able to maintain strong posture all day long, all year long, all life long, is every single repetition, you really want to perform under control, all right? Don't worry about like the time of the negative or any of that sort of stuff. Just be able to control the repetition, all right? So that's a really important aspect of loading a muscle effectively, because a muscle has a concentric and an eccentric phase, and if we're not functionally strong in both of those, we can't really do anything with that muscle. So to just review, what you want to do when you're doing a pull-up is you want to accomplish at some point, whether you offload or stay loaded, you want to accomplish shoulders back and down, chest up, and as you pull, you want to approximate your shoulder blades, your scapula, so they come in, and that's going to activate all of your postural back muscle. Really all of your back muscle. It's not going to build your lower back a whole lot because your lower back is more concerned with pulling things off the ground. But it's going to activate it. And it's going to activate everything in a very functional way. And by most immediately in terms of function, standing properly, right? So we're going to exaggerate it with our contraction there. But what that causes is a tighter resting tone of our back when we're going through our daily life. So by creating that tighter resting tone, we offload the chest, and this starts to go away, okay? I like doing, gosh, you gotta start with one good pull-up, right? And like I said, there are a lot of ways to build up to being able to do that. If you're someone that's just excellent at pull-ups, I recommend sticking with sets of about 10, maybe like 10 sets of 10 or something a couple times a week, so that every single repetition you're able to do perfectly. Because once your posture breaks down, then all of a sudden you start sending the wrong message to the brain as far as recruitment, and then you start to develop a bad habit, because that's really what motor chains and muscular patterns are all about, is telling the brain how we should recruit muscle. That's why you see powerlifters who are at a very low body weight able to lift incredible amounts of weight. Their musculature really shouldn't be able to do. It's because they're able to recruit so quickly and then subsequently develop so much torque and horsepower in order to get that weight up. And it's not something that they can necessarily sustain. It's that recruitment pattern. So we want to go ahead and set baseline recruitment patterns for how we want to exist in our daily life and go from there. If you can't do a pull-up properly, then a good thing to do is to start with a high pulley row or pull down. As an example with these guys, a pull-up is pulling anything above your shoulders to you. So with the fulcrum here above me, and there's a YouTube video of me showing just this exercise on its own, right here, doing this movement, I can start to practice the ability to do a pull-up properly without having to use the same amount of weight. You can always put some extension or some breakdown into your lower back, but actually flexion, but I'm keeping my lower back in extension and really simulate what that pull-up is. So I hope that's helpful. If you're going to do one exercise to really work on improving your posture, starting with building blocks and then working into a pull-up is probably the best thing you can do, especially if you stick with the way I've explained it, which is kind of an exaggerated textbook version, but from a functional, practical standpoint in terms of rehabilitation of shoulder injuries, bad posture, neck pain, all of those things, that's the way to do it. If you do it that way and you do it consistently, you will improve, you'll get really strong, and you'll feel better.